Children are really fun to take care of. If I could just take care of children all the time, I would. No offense to you adults. But children usually don't need chiropractic care. Now they should be checked, because if they do need it, we don't want them growing crooked. But if they don't need it, then that's great, and that's the best thing possible. Children's bones, when they're born, are still soft. They're not totally solidified, so they can take a lot of tumbles and not actually really sustain any major injuries. Now, obviously, there's limits to that. Sometimes if a child has in utero constraint before they're born, that can cause a neck injury. If a child is born by C-section, it actually often becomes a neck injury. A difficult or prolonged vaginal birth also can cause a neck injury. However, most children are fine when they're born. The body is meant to take a lot of those stresses. But one of the things we look for, or give us a clue that a child may have a problem early in life, in infancy, is colic. Colic is one of the big things. Also, when the head twists and they can't seem to straighten out, and it often seems to be related. So maybe they're not nursing well on one side. What we found is that usually those children have a neck issue. Once corrected, the muscles relax, the digestive system and the muscles in the digestive system relax, start doing their jobs properly. Another problem I see in children, often a little bit older than infants, is chronic ear infection. Now, ear infections every once in a while, getting sick every once in a while, that's just part of the child's natural immunity being built. Okay, if a child doesn't get sick all the time, they're in a hermetically sealed environment, they're probably going to grow up and have lots of other health issues. But occasional ear infection, getting sick, just kind of normal. Ride it out. Give them proper nutrition. Try not to have to give them any drugs. Let them just go. But if they develop a chronic ear infection, the doctor is saying maybe they need to use tubes in the ears. It's probably a neck problem in my experience. Every child that I've had come into my office with those issues has cleared up. We've found a neck problem, we've corrected the neck problem, the immune system corrects itself, the body starts functioning properly, the eustachian tubes that should remain clear, the connection between the ear and the back of the throat, in children is fairly straight, which is why they don't drain properly and can get ear infections. But if they get chronic ear infections, a lot of times the muscles around them tighten, and so it blocks things. And when we adjust the neck, if the neck is out of alignment, it allows those eustachian tubes to open back up again and properly drain. Another issue I've seen commonly in children a little bit older than the toddler is the bedwetting. Often that's just because you know that those children should be able to sleep through the night without wetting their bed. But and there can be many issues that can cause bedwetting, but one of them does seem to be a neurological issue caused by a problem in the neck. So I've had some patients that have come in as children, I've adjusted them, it's cleared up. I've had others where it hasn't, it was some other issue, but they did have a neck problem and may have been part of the whole equation.